Chapter 20, Therapeutic Agents for the Cardiovascular System. I'll skip over the terms and definitions for now, but we'll go through them as we progress through the chapter. There's quite a few for this chapter. This table lists select common drugs for conditions of the cardiovascular system, and of course, all of their pronunciations. We'll also go through those as we progress through the chapter. The heart sits in the chest cavity between the lungs. It is a large muscle about the size of a fist that initiates systemic arterial pulse waves, causing blood to circulate throughout our body and supply it with nutrition and oxygen. The heart muscle is called the cardiac muscle. Arteries are large blood vessels that extend from the heart. These arteries flow into smaller arterioles and ultimately into very small blood vessels called capillaries. The capillaries facilitate oxygen and nutrients exchange within the body tissues. Figure 20.1 depicts the anatomy of the heart. A normal heartbeat is 60 to 100 times per minute, and it is surrounded by connective tissue called the pericardium. Ligaments anchor it to the chest wall and diaphragm. The heart wall has three main layers: the endocardium, the inner layer, the myocardium, the middle layer, muscular layer, and the epicardium, the outer layer. The heart has two sides, each of which has two chambers. The first two chambers include the right atrium and the right ventricle. Blood circulates through the body, exchanging oxygen, nutrients, and other substances in tissues and organs. The blood returns to the heart via two large veins called the superior vena cava and the inferior vena cava. The superior vena cava transports blood from the upper portion of the body, and the inferior vena cava carries blood from the lower portion of the body back to the heart. From the vena cava, blood empties into the right atrium and travels into the right ventricle. During a heartbeat, the right ventricle contracts, expelling blood into the pulmonary arteries. The pulmonary arteries carry blood to the lungs, which fully oxygenate the blood from room air. Interestingly, the pulmonary arteries carry deoxygenated blood, whereas most arteries carry oxygenated blood. Remember, it is the direction a vessel travels to or from the heart that makes it an artery or a vein. The left atrium receives fully oxygenated blood from the lungs via the pulmonary veins. Blood then passes to the left ventricle. The left ventricle contracts, expelling the blood through the aorta and outward through the vasculature to the body. Although the heart is efficient, it is still must be oxygenated just as other organs are. The main arteries that supply blood to the heart are called the coronary arteries. Figure 20.2 depicts blood oxygenation. So you can kind of see how it works throughout the lungs. And figure 20.3 shows circulation of blood through the body. The cardiac conduction system provides the electrical charge that makes the heart pump. The system regulates the heart rate and rhythm. The parasympathetic and sympathetic branches of the autonomic nervous system have opposite effects on the heart rate. The parasympathetic nervous system slows the heart. The sympathetic nervous system increases heart rate. In response to exercise or emotional stress, the adrenal glands release norepinephrine and epinephrine to increase the heart rate. Blood pressure is the force exerted by the blood against the inner walls of the blood vessels. The blood flow depends on heart rate and force of contractions. When the heart works harder to increase cardiac output, blood flow increases, causing a rise in blood pressure and vice versa. Blood volume also affects blood flow. For example, if blood pressure can fall in a dehydrated patient, or it can rise with excess body fluid. We express blood pressure readings as systolic over diastolic pressure. Peripheral resistance is resistance to blood flow caused by blood viscosity and the force required to pump blood through the vessels. When peripheral resistance increases, blood pressure increases. As the diameter of blood vessels decreases, vasoconstriction, peripheral resistance increases. Vasodilation, on the other hand, is an increase in blood vessel diameter that results in a peripheral resistance decrease. Hormones can also regulate blood pressure in response to low blood pressures. Kidneys release renin. This enzyme acts on a plasma protein, initiating a series of reactions that produce angiotensin II, a hormone that causes vasoconstriction. Angiotensin II also acts indirectly to maintain blood pressure by signaling the adrenal glands to increase their aldosterone output. This hormone increases kidney sodium retention, resulting in greater fluid retention and increased blood volume. This system is the renin angiotensin aldosterone system. Because many different agents treat heart conditions like coronary artery diseases and their causes, hypertension, and high cholesterol, it's important to not only understand the medication types, but their mechanism of action and possible side effects. Before discussing individual cardiovascular conditions, let's first discuss some common drug classes for cardiac conditions. A, B, C, D, the mnemonic works for blood pressure medications such as angiotensin converting enzyme, ACE inhibitors, beta blockers, calcium channel blockers, and diuretics provide a framework to remember these drug classes. Table 20.1 lists select drugs used in the treatment of cardiovascular conditions. So you can see for angiotensin converting enzyme, I've highlighted that the general use is for hypertension. If you look at all of these generic names here, they all have pril as a common ending, and their general effect is to prevent blood vessel constriction. Antiplatelet agents are used for thrombosis. They prevent blood clot formation, such as aspirin, clopidogrel, Ecotrin, which is aspirin. Beta blockers. If you look at all of these, they all have an LOL ending or OLOL ending. Bile acid sequestrants. They lower cholesterol. We have Prevolite, Questrin, Colistid. We have calcium channel blockers for hypertension, diuretics for hypertension and edema that reduce fluid volume, angina treatment, so nitrates, they relax blood vessels, allowing more blood to reach the heart. ACE inhibitors help reduce blood pressure by dilating arteries. The ACE inhibitors' net effect is peripheral vasodilation and blood pressure lowering. Lisinopril is a very common ACE inhibitor. Benazepril. Angiotensin II receptor antagonist, also known as angiotensin II receptor blockers, ARBs, work by inhibiting the effects of angiotensin II on angiotensin II receptors. The net effects are very similar to those ACE inhibitors, including a reduction in blood pressure due to net vasodilation. That class, we have Cozar, Diovan. And we just talked about this when I was going through the chart, but ARBs have that common ending of sartan. ACE inhibitors have the common ending of pril, and beta blockers have that common ending of OLOL. In 2015, the FDA approved Entresto, a combination medication for heart failure. It contains valsartan, an ARB, as well as a novel medication called sacubitril that inhibits naproxen, an enzyme that normally affects endogenesis peptides involved with blood pressure. Another way to alter the renin angiotensin aldosterone system is to use Tecturna, which inhibits renin, resulting in many downstream effects, including reduced aldosterone secretion, less water retention, and less vasoconstriction. Beta blockers block both norepinephrine and epinephrine from binding to beta adrenergic receptors. Blocking these receptors reduces heart rate, which can help lower blood pressure and regulate heartbeat in patients with tachycardia. Some examples: atenolol, used for hypertension, angina, and myocardial infarction, like a heart attack. Metoprolol tartrate and succinate. Propranolol, which is used for a lot of different things now: hypertension, angina, atrial fibrillation, tremors, migraine prophylaxis, and is even used for chest pains and anxiety and things of that nature. Calcium channel blockers reduce the heart muscle and blood vessel calcium influx. This leads to vascular smooth muscle relaxation, which leads to vasodilation and lower blood pressure. The two main CCB classifications include dihydropyridines and non-dihydropyridines. Some examples: Norvasc, Cardizem. Hypertension or high blood pressure affects millions of Americans. The disease gained the moniker silent killer because few obvious signs accompany it. When the cause of hypertension cannot be established, we call it essential hypertension. Hypertension with a known cause is called secondary hypertension. Some patients with severe hypertension may have symptoms such as nosebleeds and or headaches. However, most people are asymptomatic. And here's box 20.1 is a chart with all of the different classifications of blood pressure. So normal is below 120 for systolic and below 80 for diastolic. Hypertensive, going all the way to the bottom, is a systolic over 180 and a diastolic under 120. Table 20.2 lists select medications used for the treatment of hypertension. We already talked about the ACE inhibitors, beta blockers, ARBs, direct renin inhibitors, calcium channel blockers. Loop diuretics, we haven't talked about yet. We have Lasix and Bumex. Thiazide diuretics, microzide and diuryl, metolazone. Potassium sparing diuretics like aldactone and triamterene. Alpha-1 receptor blockers, which we talked about, not in this chapter, but other chapters. Alpha-1 receptor blockers, doxazocin, terazosin, and prazosin. Those are all used for heart conditions, and they can be used for BPH in male. Alpha-2 adrenergic agonists like Eldomet and Catapres. Hypotension is low blood pressure. One of the more common problems that people experience is orthostatic blood pressure. This occurs because a large amount of blood remains in the lower extremities, the ankles and feet. When a person stands quickly, the blood returning to the heart decreases considerably, and the body responds by increasing the heartbeat, compensating for the lack of blood flow. Medications used for the treatment of orthostatic hypotension are fludrocortisone, midodrine. Hyperlipidemia, also known as hypercholesterolemia, is a bloodstream cholesterol level increase that can lead to atherosclerosis or arterial hardening. Atherosclerosis increases the incidence of angina, heart attack, and stroke. When discussing body fats, it is important to recognize that cholesterol is only one lipid type and it performs many vital functions, including steroid hormone and cell membrane synthesis. When people eat high fat and high cholesterol foods, they often ingest too much. This leads to a body fat buildup. In addition to diet, hyperlipidemia is also an inherited condition, meaning you get it from your family members. The most widespread genetically associated disorder is familial hypercholesterolemia. Blood tests measure serum levels of different cholesterol levels, such as low density lipoproteins and high density lipoproteins. The LDL function is to carry cholesterol to the tissues where it can lodge in blood vessel walls and contribute to atherosclerosis. HDL, or good cholesterol, removes cholesterol from the arteries and transports it to the liver. Triglycerides are another form of cholesterol linked to atherosclerosis development. Table 20.3 lists select medications used for the treatment of hyperlipidemia. In nicotinic acid, we have niacin. Bile acid sequestrants, we have Questrin, Colistid, Welchol. For statins, which are a nickname for HMG, CoA reductase inhibitors because they have a common ending of statin, atorvastatin, lovastatin, pravastatin, simvastatin, rosuvastatin, fluvastatin. Fibrates like gemfibrozole and fenofibrate. The only cholesterol absorption inhibitor, Zetia. PCSK9 inhibitors like Praluent and Repatha. Omega-3 fatty acids, such as fish oil, which is not the same fish oil that you get over the counter. It's a prescription strength Lovesa. Bile acid sequestrants such as cholestyramine increase cholesterol loss through the GI tract. They do this by binding to GI tract bile acids to prevent reabsorption. Because bile acids are made from cholesterol, the loss of bile acids through the feces has a net effect of lowering cholesterol levels. Fibrates such as gemfibrozole and fenofibrate are less effective at lowering LDL cholesterol, but can increase HDL levels and lower triglycerides. Because of this, they are frequently used in combination with statins in people with persistently low HDL and high TG levels. The exact mechanism by which fibrates affect cholesterol is still not known. Nicotinic acid, niacin, is a B complex vitamin that reduces LDL and TG levels and increases HDL levels. Although the exact mechanism by which niacin treats hyperlipidemia is unknown, the effect may come from niacin's role as a vitamin. Zetia is an oral medication approved as a monotherapy or in combination with statins or fenofibrate for hyperlipidemia. Heterozygous familial hypercholesterolemia is a genetic disorder that results from a defect on chromosome 19 that codes for low-density lipoprotein receptor, which is a protein found extensively on liver cells that binds to and clears LDL from circulation. Prescribers can use high-dose statins, bile acid sequestrants, or a relatively new medication class called PCSK9 inhibitors. They break down LDLR, reducing LDL. And there's two medications in the US that are currently available, as mentioned previously, Praluent and Repatha. Atherosclerosis is a syndrome, which is more than one condition, that affects arterial blood vessels. Inflammation occurs as a result of the lifelong buildup of small plaques, mainly composed of lipids and the clumping of platelets. Over time, small injuries can occur in the vessel wall. Arterial sclerosis is a condition that results from thickening, loss of elasticity, hardening, and calcification of arterial walls. Hypertension, hyperlipidemia, diabetes mellitus, and normal aging all contribute to arterial sclerosis progression. Often when someone has atherosclerosis, they're also going to have arterial sclerosis. Angina results from a decrease in cardiac blood flow, which causes chest pain or a sense of pressure. The pain can vary from minor to severe. Hardening of the arteries, hypertension, and cigarette smoking can decrease blood flow. Environmental and genetic influences can also play a role in acquiring chest pain. The three angina types include 1, stable angina, 2, variant angina, 3, unstable angina. Table 20.4 lists select common nitrate agents. Nitroglycerin has a bunch of different types of medications and a bunch of different dosage forms. Isosorbide mononitrate and dinitrate. And you can see here's a prescription for nitroglycerin 0.4 milligrams sublingual. They want them to take 1 tablet sublingually every 5 minutes times 3 doses. If no relief, call 911. The formation of a vessel clot blocking blood flow is a thrombosis. Coagulation, blood clotting, is a normal body function aimed at stopping hemorrhage and starting healing. Unfortunately, our bodies can also form unwanted blood clots. This clotting can occur because of an overactive clotting mechanism that can be genetic, results from a narrowing of the arteries, or may be due to prolonged inactivity. An embolus is a blood clot that is broken away from the thrombus, the main clot, and traveled through the body to another area where it can become lodged and create a blockage. Thrombi and emboli can precipitate myocardial infarction, stroke, or deep vein thrombosis. Table 20.5 lists select anticoagulant and antiplatelet agents. Warfarin, heparin. We have antiplatelet agents like aspirin, clopidogrel, xylostazol, factor XA inhibitors, apixaban, Eliquis, direct thrombin inhibitors, Pradaxa, Reflutin, glycoprotein 2B3A inhibitors like Aggrastat or integrilin, thrombolytics such as Activase, Retivase, or TNKase. Another type of anticoagulant is warfarin. Unlike heparin, orally administered warfarin is for long-term use and usually taken once a day. Warfarin interferes with vitamin K dependent coagulation factor synthesis in the liver. Prothrombin time and international normalized ratio test monitor how long it takes blood to form clots while the patient is taking medication. A warfarin overdose can potentially cause life-threatening bleeding. It interacts with many prescription medications, OTC products, herbal supplements, and even food. Another medication class that reduces clot formation is the antiplatelet class. Drugs in this group include aspirin, clopidogrel, and Efient, among others. Antiplatelet agents bind directly to platelets, inhibiting aggregation and clot formation. If coronary blood flow to a heart area becomes entirely blocked because of a thrombus or embolism, that area of the heart muscle cannot receive necessary oxygen. This results in heart muscle death, a condition known as myocardial infarction, also known as a heart attack. Select agents used in the treatment of acute coronary syndrome and myocardial infarction are in table 20.6. Vasodilators and anti-anginal medications like nitroglycerin and isosorbide. We have opioid, morphine, gas, oxygen, beta blocker, metoprolol, anticoagulant, heparin, thrombolytic, alteplase, antiplatelet in combination with aspirin. Transient ischemic attacks are caused by a short period of reduced oxygenation to the brain. This can be due to an atherosclerotic cerebrovascular disease. TIAs are similar to strokes, except that TIA duration is much shorter, with typically no permanent loss of function. The two types of strokes are ischemic clot strokes and hemorrhagic bleeding strokes. Hemorrhagic strokes can occur when weakened vessels or aneurysms in the brain rupture. When a vessel ruptures, blood flows into areas of the brain, causing damage. Additional injury is caused by the lack of oxygenated blood flow to areas of the brain where it is needed. Most of the symptoms of TIAs and strokes may appear rapidly. Heart beats in a regular rhythm. This is accomplished via special fibers that run through the heart. The pacemaker is in the SA node. Many factors influence the efficient operation of the pacemaker, including chemical balance. If an imbalance results from chemicals like electrolytes or oxygen deprivation, irregular heartbeats, or dysrhythmias can occur. Medications can also cause dysrhythmias. Depending on the severity, acute care may or may not be required. Table 20.7 lists select agents used in the treatment of arrhythmias. Beta pace, the name kind of goes along with what it's for. Coridone, Pacerone, Lanoxin, Norpace, Rhythmol, another one that kind of goes with it. Multec, xylocaine. Heart failure is a progressive disease in which the heart cannot pump enough blood to meet the body's oxygen and nutrient demands. Edema is a characteristic heart failure component because the kidneys compensate for the lack of blood flow by retaining more fluid. This fluid increases the heart's workload, further weakening it. Table 20.8 lists select agents used in the treatment of heart failure. Acute heart failure, loop diuretics, vasodilators, natriuretic peptide B types, adrenergic agonists, phosphodiesterase and enzyme inhibitors. For chronic heart failure, ACE inhibitors, beta blockers, loop diuretics, thiazide diuretics, cardiac glycoside, aldosterone inhibitors, vasodilators. Digoxin is a very popular medication used in both outpatient and inpatient pharmacy. It's indicated for heart failure or atrial fibrillation. It's popular because can be given orally or be administered, injected into a patient. The antidote for a digoxin overdose or symptomatic toxicity is digoxin immune fab, Digibind. This agent binds to the digoxin molecule and the drug is excreted from the body. This treatment must be done in the emergency department and the antidote is available in injectable form only. Lastly, take a look at these sound-alike, look-alike drugs, Cardine versus Cardizem, Lodazin versus Lioresal.